about every small query I have about skin and hair. And today I've made a list of all the questions that I've had. And the best part is I have 5 dermatologists here with me from across the country who are here to answer them. So let's have a look at our panel today.
Hi, I'm Dr. Anurag Tiwari and I practice in Bhopal, Madhya Pradesh.
Hi, I'm Dr. Flora. I'm from Apollo Cosmetics, Chennai.
Hi, I'm Dr. Divya Sharma from Whitefield, Bangalore.
Hi, I'm Dr. Dinesh, a practicing dermatologist from Chennai.
Hello, I'm Dr. Rajetha Damisetty. I practice in Hyderabad.
Great, so let's get started with the questions. Dr. Anurag, what is that one must-have product in my travel bag?
Depending on the occupation, if you're an outdoor person, once again, as everybody has echoed, a sunscreen is a must. If you're not a very outdoor person, you need a good moisturizer, which should be there with you in your bag.
How does one choose a right sunscreen? Dr. Annie?
Based on the type of the skin that they belong to. If they have a sensitive skin, then they need a separate kind of a sunscreen. If it is an oily skin, then they need a gel or a matte finish sunscreen. Something which they will be compliant with. You give them a lotion, then they are not going to like it. So when they go and directly when they choose, they can see whether it's going to cause acne in an acne-prone skin. It should not cause. And it should not be very oily if it's an oily skin already. So they have to choose according to their skin type. And if they are at a loss, then their doctor will be the best person to.
The indices that you look at, there's this SPF thing, which doesn't really make a lot of difference to us because we're not scared of sunburn. Now, SPF talks about protection against UVB, but what we are looking at, whether it's prevention of tan or prevention of worsening of pigmentation that you might already have, prevention of photoaging, you're looking at UVA. So you might want to look at something called a good star rating or a PA plus or a triple plus. So these are the indices that you want to look at.
Dr. Divya, gram flour, milk, sandalwood powder and turmeric. Is it a good scrub?
They are our biggest enemies. And probably, I think patients land up more with us when they're using all this. I completely, will desist the patients to use anything like that at home.
Okay. Dr. Anurag?
Well, all these things have been traditionally there, and the patients don't know that this groundnut, the flour and all, they actually cause more dryness. So for a person with oily skin, maybe it could be applied and the person can get away with it. A dry skin person would apply milk or a curd and get away with it, but it would be counterproductive for the opposites. So if you have a normal skin, a healthy skin, these are things which can be done at home. They don't give you any protection, they don't give you any benefit out of doing that. So it is better to have a controlled regimen using properly standardized available creams, lotions and things like that to give you a better and a cleaner and a neater skin.
And how can I reduce my acne redness scars?
Thing is like, as Dr. Rajetha said, it's the earlier you see, the better. The problem is invariably most of the patients who come to us end up asking, what is the natural way of treating this? Is there something you can give me without being organic, not then being chemical? I always tell my patients a very simple example. If I'm going to treat you with curds, you may call me an Ayurved. If I'm going to treat you with lactic acid, I become an allopath. It's as simple as that. So ultimately everything boils down to molecular level, which we allopaths use basically. So the problem with natural therapy is it may work in some people, but most often it doesn't work in some people and it may aggravate. And people, in the ignorance that it may work, they keep using it until the problem becomes fully blown out. And at last they come to us where it becomes really difficult. A very good example would be a person with chronic hair loss. They just go applying eggs to the hair. They're thinking that, okay, my hair is getting nourishment. Honestly, it really doesn't work anything. Probably a little bit of shine it may give, but you're not looking at anything else. Whereas if the person was consuming the egg every day, probably it would have supplemented the proteins and that would have actually contributed a little bit to reduce the hair loss at least. So there's nothing like really you try to natural way about it.
One quick fix for super shiny hair. Dr. Annie?
No. Nourishment has to come from inside. So a good diet with enough of proteins and antioxidants and micronutrients will only give a good shine from within. But anything external, they can go in for conditioners. Pre and post wash conditioners they can use for a shine. That's like a quick fix. But that's not a permanent solution.
One last question to add to all the probably stupid questions that you thought were here. What is the silliest emergency that you attended to?
Midnight call about a pimple.
Dr. Dinesh?
Can't recall of that.
Yeah, it does happen. Night 11 o'clock, 11:30 call, rash, emergency. then anyway we see them the next morning or tell them to go to a casualty, it will end up with a fungal infection being there for more than 2 months.
Okay. So I think we had a very interesting session, and I think we burst a lot of myths in this panel discussion, and thanks to all the panelists present here. We hope you like this video, and if you do like the content of this video, please do subscribe to the channel, which is Skin Diaries.